week's edition of Keith's Questions. This month's Q&A vidcast is in relation to a question we've had that's come in from Twitter via Keith. Keith has asked, why are we recommended to bend our knees and not flex through the trunk when lifting heavy objects from the ground? To answer this question, we are joined by our regular guest speakers, Dr. Keith and Dr. Keith, renowned in their field for research. How would you like to answer this question today, doctors?
First, we need to establish the anatomical structures which are involved in these two types of movement. The spine, which consists of vertebrae that are stacked upon each other to create a vertebral column, are made of vertebral bones, and in between these bones are fibrocartilaginous discs, which create an amphiarthrotic joint which allows slight movement in all directions. The main muscles that are involved in trunk flexion and extension are the rectus abdominis, the internal and external obliques, and underneath all of this is the psoas major. On the back, when we turn it around, the erector spinae and the latissimus dorsi also assist. The two main joints involved in squatting are the knee and the hip joints. Both of these joints are diarthrotic joints which allow a lot of movement in certain planes. The main muscles of hip flexion and extension are the psoas major, which is under here, tensor fasciae latae, the rectus femoris, and the anterior adductors. Also on the back side we have the gluteus maximus and the hamstring muscles. The main muscles involved in knee flexion and extension are the quadricep muscles as a group and the hamstring muscles as a group.
Biomechanics of lifting a weight is a complex process which can involve an extended number of prime movers, antagonists, synergists, and stabilizers. Depending on the technique used, this can involve the musculature of the lumbar, abdominal, and lower limb regions.
You're not wrong, Dr. Keith.
I know, Dr. Keith, thank you.
Furthermore, incorrect form incorporates the use of the erector spinae, which is a long muscle with an inferior yield point compared to other agonists. It is not designed for heavy load bearing.
That is true, that is correct. The muscle fibers of the erector spinae, which synergize with the intrinsic musculature of the spine due to their multi-pennate fiber arrangement, do not provide sufficient force distribution to complete the movement efficiently without approaching load failure.
Again, you're not wrong, Dr. Keith. If I could expand on that, the strength of a muscle fiber is dependent on its design and characteristics, which include cross-sectional area, the fiber recruitment and arrangement, the number of muscles involved, whether it's an agonist or an antagonist, the joint type, and the friction coefficient of that joint.
When using correct lifting form as shown here, the prime movers are the quadricep muscle group and the hamstring muscles. These muscles are designed for heavy load bearing and powerful extension of the patella joint due to their large cross-sectional area and bipennate arrangement. These muscles are synergized with the gluteus maximus, and together they produce a high output of force without placing unnecessary pressure on the joints of the spine.
As you can see, there is a clear contrast between the muscles activated during each type of lift. Bending the knees and retaining a neutral spine allow for a powerful and efficient use of the quadriceps muscles while reducing intradiscal pressure.
Now it's back to you, Mrs. Dr. Keith.
So doctors, now we're familiarised with the anatomy and biomechanics of the proper lifting technique. Tell us what the consequences are of not utilising this technique.
The most common injury to occur as a result of incorrect lifting technique is disc herniation, usually in the lumbar section of the spine around L4, L5 or L5, S1 vertebrae. The exterior of an intervertebral disc, the annulus fibrosus, is composed of strong annular fibers, while the anterior nucleus pulpus contains mucoprotein gel, which acts as a shock absorber. Over time, the fibers deteriorate and begin to rip, while the gel loses moisture and its shock-absorbing abilities. Once the exterior fibers begin to degenerate, the gel can leak out of the disc and between the vertebrae, compressing the spinal column and resulting in a herniation.
In treating herniations, heat and ice, NSAIDs, cortisone injections, and osteopathic or chiropractic manipulation can all be utilised. If pain continues 6 weeks post-injury, microdiscectomy surgery can treat the pain by removing the disc material from under the nerve root.
We hope that answered your question, Keith. Thank you for joining us, Dr. Keith, Dr. Keith, and Dr. Keith.
Thank you.
I'm Mrs. Dr. Keith.
Join us next week for another episode of Keith's Questions.